If you had COVID and months or even years later you're still sick, don't think you're the exception to the rule anymore. You're probably in the majority, and you have what's called post-COVID syndrome. And yes, there are approaches to helping people with this specific issue, and we're going to discuss some of that today. Hi, everyone. I'm Dr. Mitch Ghen, the Chief Medical Officer of Hue Light USA. And today we're going to talk to someone who literally survived, improved, and pretty much is back to a healthy, normal life after she went through a horrible post-COVID syndrome. And we're going to share her story with you because you're going to feel very akin to her for many reasons, but for one, because so many of you that are watching have had the same problem and don't know where to turn. Most doctors don't even know where to turn as well. Today, my guest name is Star. Star is a star. She is a triathlete. She is a coach. She has been on the U.S. teams. I mean, she'll tell you more about her. It is an unbelievable curriculum vitae that she exposes herself with. But the problem is not that. You could be anybody, even as good as an athlete as Star is, and still be pretty much bedridden from post-COVID syndrome, not the actual COVID. We know the problems, but post-COVID syndrome as well. Let's say hello to my guest today. Star, thank you so much for joining us. I appreciate being able to talk to you and tell your story to everyone.
Thank you, Doctor.
Well, it's great to have you here. We could talk all day about your accomplishments, and they're amazing. If there's anything you want to add to what I've already said, please tell folks about you a little bit.
Well, I am a triathlete, and it's something I'm very passionate about. I love what I do. I love my sport. I'm surrounded by positive, active people. But last year, after COVID, I pretty much got stopped in my tracks.
Well, let's talk about that. And I think people want to hear first, how was Star's health before COVID? You even got COVID. Let's start with the so we can chronologically look at what happened and your ascension to good health again. How were you before, Star?
Excellent. You know, I strived in my life to keep myself healthy. I was a very sickly kid. So very early on, I started eating well. That was a whole adventure, but I eat very clean. I exercise, and I'm smart about nutrition, hydration, going through coaching school with USA Triathlon. We have the best teachers, Olympic, sports doctors, coaches. So I learned from the very best, and I learned how to balance it for me. So I was really healthy.
And then COVID hit when? Give us a time. When did and do you know what variant you had? You may or may not.
I don't know what variant, but last September, I was exposed, thought I had beat it, but within a week, I was laid out. Like, I thought it was the flu. It was just like the flu. I was flat out 4 days, but my doctor tested me. It wasn't the flu. It was COVID.
Okay, so during that period, were you treated with any medications during the time you had COVID?
No, because my doctor said the one treatment was worse than it didn't help. And it would expose me to getting it again. I didn't want to do it anyway. I just drank a lot of fluids, electrolytes, ate simply but really good. And within 4 days, I was working again.
Excellent. So about 4 days later, you're back to work. Are you full energy at that point? as if you were prior to COVID, or was there something already not yet perfect?
You don't really notice it because you're so wiped out for those 4 days. But within a week, I kept thinking I should feel better. Now, my friend, a PA, had come on the 3rd day and given me a vitamin drip.
Okay.
So I felt better. And I even went for a walk. I needed the fresh air. I needed to be in the fresh air. But then 3 days later, the exhaustion, and I was sleeping. I felt like I was sleeping all the time. And then the weeks that followed, I couldn't get a full breath of air. So the doctor tested me for everything, checked my blood, said everything's fine, go do what you do. I think without them knowing, that was the worst thing I could do, because my organs were already, they were already being taxed. Now I was pushing it, but I constantly have to stop. I couldn't breathe. So I'd stop for a few minutes, then I'd get going. Biking was horrendous. Where I live in the Hudson Valley, all hills.
So basically the triathlete was out of that business, out of that capability. By the way, just so you know, I think it's important for our viewers to hear, vitamin C actually disassembles the spike protein. That's why you started to feel better. Sorry that you didn't continue that, because it would have lessened all this for you. But again, you didn't know. And the vitamin C's half-life is very short within the body. It's about intravenously a half hour. But there is the ongoing effect for a couple weeks, but it probably, maybe dampened it to a degree. So as the weeks went on since September, were the symptoms worsening, or they just stayed flat? Tell us, what you were experiencing, because again, people listening right now are going to be extremely intent on you. Here's a triathlete I would watch you do what you do, and I'll be sweating just from watching you. So for me, that would be a workout just to watch you do your 3 events. That would be it. I'd be like, oh my gosh, get me some coffee, get me juice, get me water, get me something. So if you went from this vibrant, healthy, activity of daily living, being perfect woman, give us now, again, you're exhausted. Was that the only symptom? That's my first question. And did the symptoms just stay and stay? Did they worsen? What happened?
So the exhaustion got worse. All I was saying to my colleague all through the day was, I'm just so tired. My friends, my workout buddies were very concerned because I was trying to get back in shape very progressively. I wasn't trying to kill myself. I'm very protective of my health.
Of course.
So they saw me trying to do things right, but they saw me getting worse. I felt horrible. I kept trying different things. I was amping up my C, my zinc, my B complex. I was eating really healthy. Nothing was working. And then some other things started happening.
What were they? Tell us.
So I had issues. They did a CAT scan and told me I had a mass in my stomach. That was wrong. Then it was just different things. My organs were shutting down. It was bad. By the time I discovered this wonderful therapy up here, I was in a bad place.
And since you mentioned that, when you say this therapy up here, I assume you're talking about Hue Light USA and their main office in New York. So what brought you to them, and what happened? Give me a time first. When did you get to them? How did you get to them? And what happened after that?
So I knew I needed oxygen. My sister is in San Antonio, has a clinic, has hyperbaric. My doctor was trying to get me a prescription, but there's no code for long COVID. So I was on social one day. Two things happened. I posted how frustrated I was. I never do that. I don't post negative stuff. So I kept saying, I'm okay, but I'm struggling. I'm okay. I'm out there, but I got a letter from a friend that was part of research with NPR, and she told me they were testing 1,000 athletes with all the same symptoms and their findings. And basically, these microclots in their bloodstream, gumming up everything, so the oxygen was not being properly transferred. Then, a friend of mine, a pro Spartan athlete that was using this for his recovery, started posting, and I was like, wait a second, where is this? This is what I've been looking for. So I called him up, and he immediately got in touch with them, talked to Darren, and got me up here.
And then you started. About what month would that be?
June, middle.
Okay.
Second week.
About the second week in June, you started using the entire Hue Light composite, which we'll talk about in a minute. But after you started using it, when did you start noticing an improvement, and where and how did that progress? And then we'll talk about each of the different instruments.
So I think athletes are pretty in tune to their body. After the first session, now I was really sick, so I felt different. And when we walked out, my friend Kevin Donahue said, how do you feel? I said, you're gonna think I'm crazy, but I feel lighter, taller, like I have a weight off my shoulders. So he's like, that's not crazy, let's tell Darren. By the third session, I could breathe better. I want to say I could get half a breath. Before, it was like sucking through a straw. Mm-hmm. By the seventh session, and the whole time you're kind of like, do I feel better? No, I do feel better. I really feel better. You're talking to yourself. But I did, and I kept feeling better. After the seventh session, I was scheduled to race. I decided to go and just do it. I get there. My friends are like, "You're not gonna push this. You're looking better." But I was like, "Guys, I'm not even wearing my watch." So I went in. I'm just going for a swim. Just going for a bike. Gonna do a little run. That was my attitude. Got through the swim. Got to my bike. And I'm like, I feel good. Got on my bike, started out, just biking. Halfway through, I was cruising. I got off in transition, 1, 2, 3, like the old star, went for a run. I stopped twice, but it wasn't because I couldn't breathe. It was so freaking hot that day, the humidity, I had to get 2 glasses of water, one to drink and one to pour over me. I had a great race. My friends are looking at me like, what the? I came in first in my age group, but what I looked at that day, I beat all the 60-year-olds and would have come in second in the 50-year-olds. I was like, thank you, God. Thank you, BAHI Therapy.
Okay, that's an excellent story. Well, let me tell the folks, if you just joined us, this is Dr. Mitch Ghen. I'm the Chief Medical Officer for Hue Light USA. We're going to talk about what that is in a moment. And we're talking with a star. Her name is Star, and the last name is Walters, correct?
Correct.
And she was someone who went through what we all did. She went through COVID, but then noticed that she was no longer the triathlete she was prior to COVID. She found that if she would even try to walk, run, she would be short of breath. And the typical conventional community of physicians and studies were pretty much negative, but that patient knew, Star knew, that she wasn't feeling good. Now, the reason a lot of this occurs, as if you were watching, and hopefully you'll go back and watch the beginning, is because of a couple issues. Pretty much every disease, and specifically COVID as well, causes dysfunction of the mitochondria. The mitochondria are tiny little powerhouses within every cell, from anywhere from a few hundred to thousands. And these mitochondria produce the energy that we need to be alive. It's called ATP. That gasoline in our bodies, ATP, stands for adenosine triphosphate. And when this particular COVID hits, not only during, but it creates an enduring effect that lasts for a very long time in certain people, for years, where that ATP is not made anywhere close to the optimal, but much lower. The other thing that it does is it creates a microvascular issue. What? Yeah, well, microvascular is the tiny capillaries. You know, if you feel your pulse, that's a big artery. If you feel in your legs, you'll feel the big femoral arteries. Well, the arteries and veins get smaller and smaller until they get to the terminal ends, meaning the organs or your fingertips or your toes. And they are the capillaries typically. And these capillaries are smaller than a hair. So if blood's not getting through there, there's a problem. What's the problem? The problem is that in that little hair-like structure, oxygen, nutrients go in, and the waste material comes out. Well, I don't have to explain to anyone watching what happens if that gets stuffed up. So for a good reason, Star fell upon, because of just a friend on Facebook, she fell upon this Hue Light USA, which we call the BAHI method, Star. The BAHI, B-A-H-I. These 4 pieces of equipment are basically, I call it like the med bed of today. It is about the most technologically advanced types of equipment I've ever seen. And do you want to go through some of them with me? We can talk about them.
Yeah.
All right, let's do it. So the first thing we usually do is we put someone on that machine that's right behind your right shoulder there. It looks like you hold on. Looks a lot like a power plate. Yeah, but it's not. This particular machine, although it gently moves the body through motion, provides many different frequencies. It is a PMEF machine, but it provides also these frequencies in hertz, and that's how we measure frequencies, that literally begin to open up the channels. That microcirculation sort of just starts to rock the mitochondria to start waking up. Now, you could say, you know what, Doc, it sounds pretty, I don't know. The truth is, we're showing you that person who's been through it, and we've had hundreds are using this machinery now to be able to get their life back together again. From there, where you put in the near infrared, the photobiomodulation unit.
Yes.
Okay. So the photobiomodulation unit, which is right behind that long machine that you see right behind Star, is a machine that packs 38,800 LEDs. So to create this same exact, not only intensity, but also the same exact frequencies that the sun does at its highest point every day. The sun is 40% near infrared. So when you get in there, you're getting all the benefit of the near infrared. You could say, is that important? Well, God felt it was very important because it's 40% of the sunlight. And it typically occurs mostly in the early part of the day and the latter part of the day. And that's why animals, by the way, rarely get burned that are outside. I have many animals on my little ranch and they never get burned. And the reason they don't is because it preconditions the skin and heals the skin. But near infrared, as the light light, I'm going to let you try to describe it in a minute. Near infrared has the capability of penetrating over 4 inches into the body. It literally helps that mitochondria we're talking about. How? Well, the mitochondria has little tiny things called chromophores, which actually look for light. And the light is picked up by these things in the mitochondria, and it improves it. It also improves the amount of circulation, microcirculation, that's occurring in the body as well. So we're going from the one machine to the next. Now, Star, tell us before we talk about anything else, what you felt, what it was like to be in something that you're surrounded with 38,000 plus lights all over you. What kind of experience did you have?
It is the most relaxing, wonderful. It feels like you're in this warm cocoon, and the lights. I would get out of that and just be so calm, so relaxed, which I hadn't been in so long. I was so anxious all the time because my body was deprived of everything. Nothing was working right. Here, first the vibrations, which are so lovely, and then the light bed. And my favorite is next.
All right, so you want to talk about molecular hydrogen? Okay. For those who've never heard of molecular hydrogen, you heard of water, and you all had chemistry. That's H2O. So pretty much the molecule of creation is this tiniest little molecule called hydrogen. And hydrogen is often provided, if you look through the internet, through drinking it and things of that nature. But the best way that has been found, and it's more than 17,000 times more concentrated than drinking it, is to actually breathe in molecular hydrogen. And what it is, it makes 2 hydrogen and 1 oxygen molecule. And that hydrogen, because the molecule is so small, goes from head to toe. What does it do? Well, it's an antioxidant, just like your vitamins are. It actually helps the body make more antioxidants. That's true as well. It is an anti-inflammatory. So we have anti-inflammation, we have microcirculation, we have the mitochondria getting better. Is the combination starting to make sense for you? Well, it did, certainly for our Star. Well, tell us how you felt with the molecular hydrogen, because that was probably the one thing that helped that lung get better the fastest.
Yeah, I know it was, without a doubt. It immediately had a mood elevating effect on me.
It does.
Because I'm a glass full girl. Always have been. I was so depressed, because it had been months of not being able to find any answers. And for me, I'm always like, okay, what's my plan? How do I get out of this? How do I get healthy? How do I get over it? Give me a plan. There were no plans. So after the inhalation, because I couldn't get into the oxygen bed until recently. And I know it's because of the other 3 that I'm able to now. I had ear problems forever.
Okay.
So I couldn't go in right away, but I can go in now.
So we should tell everyone what that is that you can get into now. So hyperbaric oxygen, for those who are not aware, is a tank basically that puts pressure on room air to drive oxygen levels quite high in the bloodstream. Now, there are 3 types of hyperbaric, just for everyone to be aware. There is the low pressure, which is under 14 pounds per square inch, basically. We have the high pressure, which is the machines that were divers that get the bends that you might know of. This is considered moderate pressure, about 15. And this particular pressure is the studies are clear to show it is at this pressure where we actually help the epigenome. The epigenome is the surrounding area that pretty much tells your genes when to start, when to stop, when to go, when to not. If you get the epigenome to be healthy, then the genes will work when they're supposed to and be quiet when they're not. When you get into this, there is a pressure. Being at around 15 feet in the water, for some people that have eustachian tube dysfunction, that little tube in the ear, it's difficult. And that's probably why Star, you had so much difficulty in the beginning, because of all the stuffiness and things that went along with this post-COVID syndrome. But now you're able to get into it. How long are you staying in there?
The whole time.
Okay.
The whole time. They started me out very low and shorter time, had no problems. So now I can stay in. But back to the inhalation, the one thing I wanted to make a point of, every time I go on it and I leave here, all of a sudden I realize I'm taking this wonderful full breath. I do deal with the asthma, even that's getting better.
Super.
I can swim now without my inhaler. That's never happened.
So let's do this, Star. You were 100% before COVID. Let's call that 100%. Let's then call during COVID 0% and 0% post-COVID, because we're talking about post-COVID syndrome. So, or long haulers, whatever you want to call the name. As of today, after doing, how many treatments have you had total of this whole BAHI method at this point?
I've been here for about 5 months. Maybe the first couple of weeks I came regularly, but then there's that work thing. So once a week I try to get up, but I have missed some weeks. So fairly consistent.
About 5 months, basically.
Yeah.
Okay. So at 5 months, where's my Star now? She was 100%. She was 0. Where is Star as we talk, you and I, right now?
I'm definitely in the 90s. I did a trail run the other day. Fabulous. All kinds of elevation.
Amazing.
I can hike and run up the mountain like I used to. I'm so happy.
Well, let me tell you, you make me happy, Star, because there's nothing for me more important than watch a patient go from way suboptimal to an optimal level. Your whole journey is an inspiration to everyone that's watching. When we see this and we realize that this BAHI method has done so much for you and others, we and you specifically are inspiring them to know there's something there. Unfortunately, most of the time throughout this COVID and throughout the post-COVID period, people were saying, we don't have anything, we don't have anything. The BAHI method, which is the 4 different instruments we described, the sonic, the near infrared, the molecular hydrogen, and the hyperbarics, is a composite that overlaps to stop inflammation, microcirculation problems, and the mitochondrial failure. You are not a failure. You're amazing. And you said it perfectly at the beginning of this particular session. I see the cup half full. If you were not an optimist, you would have never tried any of this before. Final words from you of encouragement to people that are going through this. Go ahead, Star.
Just that you're not alone, you're not crazy, and there is an answer. I so wish that practitioners, DOs, MDs, nurses would take a look at this. I know people are starting to buy this therapy. I want the people in New York so that everybody has access to this. I want everybody to be able to recover the way I have. That's my Christmas wish.
And you know what? That's a phenomenal Christmas wish. For those of you who are watching that have post-COVID syndrome, you've tried, you've talked, you've been with other doctors, or you're just down in the dumps, don't be. Look at Star. Look at the BAHI method and know the cup is half full. Star, God bless you. For Hue Light USA, the Chief Medical Officer, I'm Dr. Mitch Ghen. Thank you for joining with us.